everywhere. And then we're also joined by Dr. Adrienne Simmons, who's Director of Programs for the National Viral Hepatitis Roundtable, which is a program of the Hepatitis Education Initiative. And at MVHR, Dr. Simmons works with patients, providers, and public health partners to break down barriers to viral hepatitis care with a focus on historically marginalized communities. So these are really two individuals at the forefront of hepatitis elimination in the United States and globally, and have their ear to the ground on what's going on.
Say thank you to the organizers for having me. I'll just briefly introduce NVHR. I'm going to go quickly so that we have time for questions. So apologies if I'm talking quickly. National Viral Hepatitis Roundtable is the largest network of people directly impacted by viral hepatitis, healthcare providers, as well as public health partners, working together to break down barriers to viral hepatitis care and ultimately advance elimination in the United States. Much of our work is done through sharing best practices, through advocacy, as well as policy change. And so I think our presenters did a fantastic job illustrating why community partnerships are important and the impact that they can have. So I'd like to close out by just summarizing some of the best practices that we've heard, as well as offering some thoughts about how community partnerships might continue to evolve. And so starting with the best practices, you've heard this across multiple presentations, right? The importance of early involvement, of engaging community partners as early as possible in the project development process. And that includes, in grant writing, as well as in all of the various project and research planning stages. Clear communication is critically important, right? Establishing a really clear project management plan that outlines everyone's roles and responsibilities, as well as the timelines associated with the project. Transparency is critically important for building trust and ensuring mutual understanding. So third best practice is really trying to design a partnership that is mutually beneficial to both parties. So making sure, first and foremost, that the project ultimately meets the needs of the communities that you intend to serve, but also making sure to design the research process in a way that the community partner is able to engage in a low barrier way with the research. We have lots of data and research processes that can be new or unfamiliar to our community partners. And so ensuring that they feel supported in that project is really important. And then finally, we've heard, without the words being used, capacity building, whether that's through funding, through training, through just providing community partners with the resources and support to really implement sustainable models of care that can be scaled up and maintained beyond the initial project funding. Next slide, please. And so, as I think about where community partnerships can go from here, I think it would be remiss to not mention that, community partnerships are only as effective as our systems allow them to be. And so if there are structural barriers that exist, we're going to be limiting the impact of these community partnerships. And so we're seeing various barriers decrease in the viral hepatitis space, right? We've heard mentioned that we now have universal hepatitis B screening and vaccination guidelines. We've been able to significantly improve access to hepatitis B treatment by removing things like prioritization processes. And then we will very soon have our first point of care hepatitis C test, and hopefully a hepatitis B point of care test will come down the road. So as these barriers are addressed, the window of opportunity for community partnerships really widens. And so we can, in fact, eliminate hepatitis B and C if we design our systems to meet the needs of the most marginalized communities. That's going to take centering the voices and expertise of those directly impacted, continuing to streamline our data processes and eliminating administrative red tape wherever possible, and ultimately just being willing to provide healthcare differently. All of us, as I believe Emily mentioned, have the same goal, and the devil is in the details, and often where we differ is how do we get there? And so really prioritizing developing these partnerships in a way that, again, both the community partner can provide the services that they need, but in a way that doesn't burden them with administrative red tape is really important. So I'm going to pause there and turn it over to Lindsay. I think we've got a couple of questions that we'd like to address in our last few minutes. Thanks so much for having me.